Welcome to Season 2 of Talk Lab to Me. Talk Lab to Me is an engaging discourse podcast hosted by COLA, a leading physician-directed accrediting organization that provides education and accreditation services to laboratories of all sizes. The podcast covers a wide range of topics, including the latest developments in laboratory science and medicine, as well as in-depth interviews with regulators and industry thought leaders about the importance of regulatory compliance. Welcome to Talk Lab to Me. I'm here with Dr. Melody Boudreau-Nelson, and I am so excited for our conversation today. I'm going to give a little PSA to my Talk Lab family. Dr. Nelson and I crossed paths initially at a COLA event, and we have continued to cross paths at different events since then. So my PSA to my Talk Lab family is get out there, network. You never know the amazing people that you can meet in our laboratory industry. So I want to tell you all a little bit about Dr. Nelson. She is an assistant clinical professor in the Department of Pathology and Laboratory Medicine at the University of Kansas Medical Center. She serves as the assistant director of the core laboratory with a focus on the clinical chemistry and point of care services at the University of Kansas Health System. Welcome, Dr. Nelson, to Talk Lab to Me.
Thank you for having me. I'm so excited to talk lab with you. And as always, I love seeing your smiling face at all the conferences. It's great. You're such a bright light and an energy. It's good. So I really appreciate being here and the opportunity to talk to you and your podcast listeners today.
Thank you. So we're going to do what we do here. Talk Lab to Me. So I want to know, for those out there who may not be familiar with what is the Doctorate in Clinical Laboratory Science and how it differs from other advanced degrees in laboratory science, can you tell us a little bit more about that program?
Sure. So the Doctorate of Clinical Laboratory Science is a terminal advanced practice doctorate, and it's designed to allow behind-the-scenes diagnosticians to become frontline clinical consultants. And that's really the scope of practice. It's rooted in clinical lab technical knowledge and bench expertise, but the education and the residency portion empowers us to really be integrated members of the healthcare team.
Dr. Nelson, your journey in laboratory science is incredibly inspiring. Can you take us on your career path of what drew you to medical laboratory science and then on to obtain your doctorate in clinical laboratory science?
Sure, absolutely. So I was originally going to be a biochemist. So like many, I stumbled into MLS as a career. I remember vividly the moment of working at a biochemical company, and I was working on formulations there. So we made like cleaners and industrial products, and I was in charge of making a rust cleaner. And so I had 5 iterations of that, and I was spraying a piece of equipment in the parking lot and scrubbing it. And I was like, I just don't think I want to do this forever. There's nothing wrong with biochemistry. It's great. It's important, right? Clinical safety, chemical safety and everything. But I really wanted to do like a clinical component. And so I was like, well, maybe I guess I'll go to med school. And I did what most people do. I reached out to some docs and I was like, hey, I'm really thinking about med school. And, now that I'm not doing a biochem PhD, and what are your thoughts on that? And I had one physician who really just was like, Melody, you really like the lab. You love your lab time. That's one of the things you talk about the most. And you seem to be quite strong in that regard. And he said, before I was a doctor, I worked in a medical lab. And he told me he was a med tech, and that's how he put himself through med school. And he said, honestly, it made me a better doctor. And I think that it might be a good fit for you. You should check it out. And I was like, oh, I've never heard of that before. And so I semi-stalked a local lab director at a hospital that had a level 2 trauma center. And I was like, I heard you guys have a lab in there. Like, what does it look like? And can I see it? And do you have like entry-level jobs? And they humored me, and it was a community hospital, so they had seasoned well, med techs, not MLSs, but med techs that had been on the job for 30 years, and they were like, let me show you this. Come look at this slide with me, and they really took me under their wing as a lab assistant, and I was like, yeah, this is what I want to do. It really opened the door for me to see where I could meet my lab skills in medicine at an inflection point. And I stayed in the lab for a long time. I was in the lab for 10 years before I went to the DCLS program. I got my master's in operational leadership through Rush University. And that was when I really saw the utility of having a bench side, or a elbow support type role in clinical practice. I had looked at the DCLS for some time, but I really didn't know, how would I apply it? Because that was really my question. What would I do with this if I pursued this degree? And overseeing a core laboratory that underpinned a 9-clinic PCP system really helped demonstrate to me the value of that. Having physicians know who I was and being able to come to me and ask their questions, fixing ordering for them, doing on QI work and QA work for them, really helped prove the model for me. And I was like, oh yeah, I definitely could do this. I definitely could take my bench knowledge, get some clinical knowledge, and be that, role that helps liaison between the two.
No, it's really good to hear how you came into medical laboratory science because it's so important that people understand what laboratory science is and how they can really utilize their passion in this industry. I was able to sit on a panel for COLA and hearing how people came to it, I was so surprised that the majority of the people on the panel did not originally go into medical laboratory science. Like yourself, they found it through other pathways. And I think that's just an amazing aspect of this particular industry. And for those who are, looking to grow academically, I think it's an important question to ask yourself of what am I going to do with this? Where do I fit in this healthcare picture? And that helps you sort of choose where you want to go. So I think you were asking some really important questions as you navigated, those different programs, and that's really important.
Yeah, I tell people all the time I graduated with enough credits to be like a double major plus a double minor. You can change your mind. It's
Yes.
okay because people think they have to come in as a freshman and have their life planned out. And the reality is most people don't know what they want to do until their junior year. And if you change, you can change. It is hard and you graduate with a lot of credits and maybe a bonus degree, but it's okay. You can do that. It's all, if it's in the sciences, most of those credits work in both programs.
Absolutely. And as those in the industry, we have to do our part to make sure more people know about laboratory science, and the offerings and conversations like this helps to get it out there to the audience. So you are known for bridging the gap between laboratory and the clinical team. Can you share a moment where your expertise as a DCLS graduate directly impacted patient care or clinical decision making?
Specifically with the cystic fibrosis clinic at our institution, I really learned a lot. I was part of my residency shadowing with them and learning more about the amount of lab work that's done quarterly and at every really visit and encounter with these patients. And it was just a part of the medical community that I was in, laboratory diagnostics, that I was very unfamiliar with. And so hearing the physicians talk about their challenges with things that they have to send out, the frequency of testing. And one thing that came out was this IgE testing that they do on patients, and they have to monitor that, especially if they have an exacerbation. And then if it's elevated, they want to reflex to Aspergillus specifically, as that fungal infection does really impact their patient population. And sometimes that reflex was getting missed because they would order it, they'd get the result from the IgE, maybe that patient's gone, it's been 3 days till they've had a chance to look at it, or 2 days, and then they can't add it on, right? That specimen's gone. We've discarded it in the lab or whatever. And so I worked with the send out team, and I worked with the clinician team to develop basically we built a report in the EHR for every patient who's a CF patient who's under the age of 18. If they get a elevated IgE, they fall to this report. And then we can see that and automatically pull them and get that reflex done. And so we've actually heard from family members, even of the patients, who are like, I've never seen this happen so fast before. But now we're able to, one, not miss them, but two, streamline and ensure that if they do have a fungal infection, like the team is notified a lot quicker. And so it's been a really interesting way to partner, but I would never have been able to do that if I didn't understand where we intersect the CF care model from a lab care model and where our moments of inflection are in that patient's care journey. Right. And so that's really just a good example.
That is a really good example of being able to bring that laboratory background to a project such as that. In your experience, how do physicians respond when someone with a DCLS background engages with them on diagnostic stewardship or test utilization? What type of feedback have you received working as a laboratory director?
So I think it's interesting, I think just in general, if you start with humble inquiry and most of your conversations interprofessionally and take an academic approach to the conversation that's rooted in, best practice, that those conversations go fairly well. Right. We're all here to care for the patient. And that is something that I lean with as well. We are all here with the same collective goal. And what's interesting is that I'm in an academic center. And so we really do have an academic approach where I have not had really any kickback from being part of those conversations and engaging in those conversations. It's been pretty welcome. We have we're an age-friendly health system. And so I've been able to work with geriatrics, and they're super collaborative, and they really have very good viewpoints on interprofessional collaboration. And so the more the merrier with them, right? And so I've started to partner with them more. And then what I've noticed is that there's this type of social currency system that exists, right? So I'm here to help you. Give me some low hanging fruit that I can solve for you, right? And then you have a little bit of that going into the next meeting when you're like, I really need you to maybe stop ordering this $5,000 lab test, and then they could be like, oh, I didn't know that was $5,000. I find that that's mostly like the interaction I have is I'm like, hey, did you know that panel is worth, $12,000? And do we really feel like it's high up on the differential diagnosis? And 9 times out of 10, they're like, didn't know, don't need it. And so it really hasn't been that challenging. I mean, there are moments where we're like, well, I really think that we should, I want to do it this way, and this is what I do. And it's like, okay, well, then help me understand why that test, right? And there could be a unique patient presentation where they need it. We saw this with fungal PCR at our institution. So there's a fungal PCR assay that they run. And it turns out like our internal team had done a study and published a study saying like, hey, don't order this except in these patient populations with infectious disease. They had published this in a national paper, national academic journal, and we were still ordering at a high utility. And I was like, guys, do you see how much we're ordering of this? And they were like, oh my goodness, we need to do re-education. And so it was just a good way for us all to like work together and share across like, hey, we're still sending the trend, even though you've said that this isn't the best test to be ordering an XYZ presentation, it's still being done. So can we partner together to like solve that?
As you were describing the different situations, my mind went back to some conversations we have had at the MLS level as far as interdisciplinary education. And one of the keys to that is communication.
Mm-hmm.
And what you're describing is the ability to communicate and have common goals. And in laboratory science, as we grow, as we stretch, as we, enhance our presence in those type of rooms, I think that interdisciplinary communication is so important. Would sometimes laugh when I first went to urgent care and I was working. I went from a hospital where I was just in the laboratory and only having phone calls with the nurses and doctors to then having them right there and having just this different understanding of, okay, this is what's going on in there. And they had a different understanding when it came to like, oh, wait, it takes you how long to do this? And you have to do these steps. Oh, it was just very eye-opening, I think, in both parts to have that this is, walk in their shoes type moment.
Yeah, 100%.
You've served as a mentor for many emerging laboratory science professionals. What leadership philosophy guides your approach to mentoring the next generation of professionals?
So I think it's a mix of like, for me, transformational, kind of also servant leadership type of arrangement where but I lend heavily now, especially in the role that I'm in with residents, in that more transformational space where I want them to start thinking about, what does the future look like? We're building the future of laboratory medicine. You will be beyond me, right? Like in terms of what you accomplish and what you do and where we go. And so what does that look like for you? And then within that, the same question, what unique experiences and unique perspectives do you bring to the table that are going to propel us forward in a way that I don't have, right? Or I don't see it that way, but I need your perspective and I need what you bring. And so that's really where I try to lean into, especially as like the world is just changing and value-based medicine is on the horizon. We still don't know where we fit. And so we need progressive thinkers who are going to challenge the status quo. And I like to help individuals do that and then also stretch them a little bit to think, okay, but how does this benefit the patient? Right? Everything that we're doing has to be tied into interdisciplinary work and patient benefit. And so that's great that you have this awesome idea, but then let's get that 30,000-foot view of where do we fit now? And how do you bridge with something that's already there and work in complementary function to like an age-friendly initiative or an Hep C awareness campaign? Like how do you tie it into something larger so that it's clear that lab is part of that and an integral part of that, which also helps us move forward, right? So like just trying to really lean into that as I mentor.
And I appreciate you offering yourself as a mentor because mentorship is so important. And I feel like in all industries, mentorship is really important. We used to joke that new laboratory science professionals coming in were the babies. Those have that been there about 10, 15 years were the teens. And then 20 and up, you were an adult. And coming into a laboratory where using that breakdown, they were all adults. They were all 20 plus. And here I come, this first out of school, and their mentorship, they're showing me laboratory and how to work within. To my listeners out there who have been in the laboratory for many moons, thank you. Thank you. They have seen the versions of laboratory science, and I am excited to see the upcoming versions because you are right. What does the future of laboratory science look like? What does it mean with the changing landscape in healthcare? These are very important questions, and I think we need to think progressively and outside the box and look to things that we thought, oh, it has to be this way. Maybe we can reanalyze those type of ideas.
Yeah, and I think too within that, what I've really tried to do is we've heard from staff having that bench perspective and being a bench person for so long really does help bridge like with the faculty, for example, going through and saying like, hey, can we start an internal CE program for the staff? I think they would really like that. And I'll help, I'll get faculty involvement and actually having faculty hours to be able to dedicate to that, to make it something that is interesting and they get to hear new topics or say, hey, like so-and-so might want to publish something. Like that was a really cool case study. Do you want me to help you write that up and we can put it in a journal? Like taking the opportunity to grow them as individuals will help with keeping staff here and keeping them engaged in the health system and the mission of the health system. And so I think that's all really important.
Professional development is a big key to retention and growth in this industry. So any opportunity you could take to enhance your knowledge and for your organization to support that is absolutely a good step in our laboratory science industry. So tell me, what advice do you often give early career laboratorians who aspire to take on advanced roles, such as the Doctorate of Clinical Laboratory Science?
So I think the question that I always ask people when they come to me about it and they're like, oh, I might want to do this. I might want to get my doctorate order. I said, okay, that's great. What are you going to do with it? Is always the question. And because it's hard and you need to know what your why is and you need to know how you're going to apply it when you graduate. I'm not a big fan of like doing things just to do them, right? You should have intentionality behind that. And so I really try to lean into that intentionality discussion. What do you want to do? Like, well, I want to do they might just say, well, I want to help with like quality assurance. Okay, well, what specifically about that is interesting you? Like, what is your lens? I want to understand that so that I can help develop you too, right? Because that's an opportunity for me to partner alongside with you or introduce you to people or, help build out that foundation of whatever your future practice will look like. I think that's something really important and an exercise people should do before they take on something that difficult and challenging.
And I think another good exercise would if you even back it up a little bit more before you come out of your MLT, MLS, your HTL, or any of those disciplines in laboratory science to say, before I graduate, what impact do I want to have on this industry? It really will frame where you want to get hired, what you volunteer to take on outside as far as your professional associations and committees and things like that. It really will begin shaping what you want your career to look like. And I think it's great to constantly think about that because sometimes it changes as you grow as a person, as your lifestyle changes. Those type of things do also evolve with it. You've been a strong advocate for the visibility and full integration of DCLS professionals in the healthcare setting. What progress have you seen, and what barriers do you feel still remain?
So I really like this question because I think we have to be introspective too, as laboratory professionals. Some of this, we have not been outside of our four walls before. And so what I would say is that we are outside of our four walls and people want us out there. I think that's really important to know. I've not had people say, I don't want to partner with a laboratory. I've never met a clinical team that says that. Most of them are well aware that they use laboratory services, and it's more of a question of like, well, help me understand how you can help me. Does that mean like articulating that? And then once you're able to articulate that well and really understand their practice, and again, the residency year in the DCLS really is what sets it apart from other traditional PhD programs. And so having that residency year and really getting to be part of that team and understand what goes on at the bedside and talking to patients helps improve your lens when you're just having those discussions and say, well, here's how I can help because I understand where we fit in the ecosystem of the healthcare, channels. And so that's been a pro. I would say, I think when we look at the barriers, it's really internal barriers that we're experiencing the most. I think while the interprofessional teams are happy to have laboratory at their elbow, internally within laboratory infrastructure, and I think there's some gatekeeping that really can be challenging because some individuals I don't think understand like the value-based like model or think that we're really like need to be focused on that. I think it's a change of perspective. There are some challenges with the elevator pitch, I guess, so to speak, in terms of what we do and how we do it. We're very diverse too. You got people doing this program. I'm a clinical chemist, but not everyone wants to be a high complexity laboratory clinical chemist. Like they might be a micro background or they might have a hematology background. And so I think there's still some variation and a lack of publication in the literature. And I think when you're looking at historic PhDs and publication and research, there are some reservations there. So I would say that is still an area that we could do better at.
And I think that as time goes on and we see just the growth of all these programs, that we will continue to see the diversity of the degree, much like the diversity in, other laboratory science degrees. People do so many different things. I've heard of people taking their MLS and going into healthcare law or taking their MLS and becoming, medical doctors. There's just so many different areas that the degree sets a wonderful foundation for. And with that, we're going to see the same thing at the doctorate level. We're going to see people take this degree and flourish into many different areas just as time progresses.
Yeah, we say this all the time. It's a degree, it's not a job title, right? So you could be a scientific advisor, you could be a professor. You could do a myriad of different things. I've just chosen to be a high complexity lab director. So it just depends on, what your wheelhouse is. Yeah, I like that you pointed that out. It's really important.
You've closely followed policy and reimbursement shifts in laboratory medicine. What do you wish policymakers better understood about the laboratory's role in the healthcare system?
when you're looking at policy too and insurances, you're looking at this per member per year payment, right? Like how much am I spending for someone who has Alzheimer's disease, for example? I do a lot of work in the Alzheimer's sector right now with the biomarkers integration into practice. And so what I wish policymakers understood is that that's not just a data point. It's that lab result is a small reflection of a window of time into that patient's care journey. And it is helping drive algorithmic decision making. And when we look at Alzheimer's, for example, I'll use that. We know that if you catch somebody in the mild cognitive impairment stage, you save Medicare $8,000 per patient. We know that. And because of being able to streamline care and now with these biomarkers advancing, like, can we avoid, we still have to do amyloid PET, but maybe one day they'll be good enough that you don't need amyloid PET. But by putting them in and taking on the work and the amount of work it takes to get a test live, and integrated and to change, ordering habits and practice habits. Like my advocacy is that I wish they understood that and understood that we care too, and that we can help with that longitudinal data analysis and we can help with that financial tracing. And we want to be part of that. We're part of that shared risk, right? Of like doing the work to get a better patient outcome. And we can succeed in that way. And also they can lean on us to help oversee project management for really integrative, like infectious disease work. I mean, you think about, there's a lab at California that does some amazing work with people experiencing homelessness and providing them, access to STD testing. Like there's things that laboratories care about and are passionate about that can help partner with other institutions and like really get public health policies changed and public health accessibility changed and access and equity. And so I think that I wish they knew more about how much we care. I think that's really where we're missing, because if they understood how much we care, we'd be able to articulate where our value is, and then they'd understand it a little bit better at the bottom line.
Thank you for sharing that. Going along with our how people view us, what do you think is one of the misconceptions people have about laboratory science professionals, and how can we actively work to change that narrative?
We're well aware of the black box. I think that's what most people think. We're just a black box. You bring a tube there and then a result pops out. A little bit that we're automatons. And I've even heard people say like, well, they don't have degrees. I'm like, actually they do. Just so you know. And I think there's this level of, we're so far removed, we're not doing patient care. And so that's really where I actively work to change the narrative, is that we care. The lab cares a lot. We understand the severity of what we do and the impact it has to that patient and to the doctor who's making that decision. And so we don't take that lightly. We actually take it very, very seriously. And I want to tell you more about how seriously I take it, right? And so that's kind of how I couch most of my conversations, is that, oh, you care about older adults? I care about older adults too. Did you know they like overtest older adults? Yeah, we do know that. Okay, well, how can we fix that? And so then that's really how we start the conversation. I think we have to get out of our four walls. We have to be willing to do that. It is a stretch. It's hard. That's why DCLS is valuable. I think it's a good model for people who want to be outside of the lab, and represent that liaison capability. So I think you have to start with care. We all care. Care is a human emotion. It's the same, right? We no matter what your background is, you can still care about people. And that's really where I start the conversation. I think we've got to do better about articulating that. Talking points are really important. And I think we just struggle with that because we're not taught that. We're not taught a lot of communication and storytelling and those types of things. And so we're just introverted and sometimes bad at it. Well, that's okay. Like we can improve, we can seek education and get better. So
Absolutely. The communication points, and as you mentioned, the storytelling is so important. Storytelling is a good tool to get things to stay, the human connection. And I love how you said that laboratory science professional, we care, because I would assume that most people going into healthcare are going in for the patient, but we don't sometimes even see the patient, but we feel just as attached sometimes to that patient's journey and to the better patient outcomes. And as a laboratory professional, we want to be a part of that positive patient outcome and do what we can because as I often tell students that is someone to somebody. And for that reason, we want to make sure we're doing everything possible to treat that person with dignity and make sure that we are providing accurate results in every format. So I want to know who inspires you?
I think I'm always inspired. My colleagues inspire me. They're just amazing people. Sometimes I think, when you volunteer in societies, which I think everyone should do, you get to meet some really cool people and you're like, how am I even in this room right now with these people? They're just so different and better than me and different, everyone has their different strengths. We say our A skill, my B skill, that's my D skill and that's her A skill, you know what I mean? Or his A skill. So that inspires me. But I also think like the future is so bright and like what we could be, the dream of what we could be as laboratory professionals and laboratory medicine and healthcare, and the amount of change that's on our horizon like inspires me. The people coming into our field inspire me, like new blood and new ideas and very progressive in the way that they think, and very used to being social, which is different, right? And wanting the challenge, and wanting to be challenged in a new way. I do think, I look at my kids and that inspires me, and my family and that inspires me. I think getting to meet the patients and that like as part of my gig now and getting to meet them and hear their stories inspires me and really gives me a sense of, okay, like all this work is worth it, because it's going to create a better tomorrow, a better life for mom and dad. That's how one of my colleagues puts it. That's what we're here for every day, a better life for mom and dad and my kids. We're creating that in the healthcare sphere. So the idea of what we could be, I think really inspires me, gets me out of bed in the morning.
Looking at your own journey, what accomplishment are you most proud of in your career?
I think two things. One, I got through a doctoral program and I have 4 kids. So that was a lot. I was pregnant during my residency qualifying exam, just had my baby, was holding, like have a picture of him strapped to me as I'm taking that exam. So I think just being able to do, I'm really proud of like just my husband and I, like we made it through. But then also I would say just to the ability to have some grit. I think a lot of my career, most of my career has involved some level of that, where I've had to just put my head down and say, you know what, like this is new landscape, but I'm gonna till it and I'm gonna be here and I'm gonna do my work and I'm gonna do it well, with the amount of excellence that I can. And I'm just gonna keep at it, right? And be tenacious and not take the no, and just keep going and keep working and don't let others, limit what you can accomplish, is what I always tell people. You have your goals and like you can get there. And you'll find people who will help you get there, and you'll find mentors who will help build you up and help give you a little bit extra push when you need it. So I think for me, like I'm proud of my little network of people and myself for just sticking with it and hanging in there. Like this high complexity lab thing with the DCLS, like it's been a challenge. It's been an uphill climb. I never want to undersell that to people. I want them to understand what they're getting into. And yeah, I mean, I just gritting my teeth and keep them going. Like it's not all grit teeth. It's fun too. But like there's an element of that. And I'm proud of myself for sticking to my guns.
Dr. Nelson, I really appreciate you sharing that with us, and hats off to you completing your doctorate with children and life. Many flowers and claps to you for doing that and your network. And I appreciate you being here. Do you have any last send-offs for us?
I just tell people out there, think about what you bring to the table that's unique and where you can further, and build out this laboratory community that we work in. We need you. We need your voice. We need your perspective. We need the work that you bring to the table, and consider volunteering in your societies, coming to conferences, getting to meet us. We are accessible people, and yeah, develop yourself.
And to our Talk Lab to Me family, if you want to hear more from Dr. Nelson, come on and get registered at the COLA Laboratory Enrichment Forum. She will be one of our speakers for our 2026 in Nashville, Tennessee, May 6th through the 8th. Until next time, stay compliant, stay curious, and keep Talking Lab to Me.